Assalamualaikum doctors. In this video, I am discussing about Myasthenia gravis history. So, how can we take Myasthenia gravis history? First of all, I am telling Myasthenia gravis. We know it is an autoimmune disorder. Here, antibodies is against the acetylcholine receptors. So the child has feeling so much fatigue with time. It is like evening time. It much more increases. They have droopy eyelid. They have blurry or double vision. So eye problem presents. I'm telling the features. In myasthenia gravis, remember 6D. That is diplopia, snarling faces, dysarthria, nasal voice, dysphagia, nasal regurgitations, dyspnea, descending weakness, and deep tendon reflexes are preserved. So chief complaints may be that is a 7 years old boy with history of fatigability, reduced exercise tolerance, and recurrent chest infections. So child fatigue so much and reduce exercise and recurrent chest infections. Others are like difficulty in walking can be complaints, difficulty in swallowing. So these are the issue. So first, as usual, chief complaints analysis. Ask first, are they started together or one by one? Then start with the serious one first. Onset, course and durations. Anything make it better, anything make it worse. The timing. At the end of the day, it actually increase the fatigue, tiredness and stress and relieved by rest. Site of weakness, unilateral or bilateral, where starts first? Does she have weakness in going up and downstairs? Any weakness on combing her hair? Any abnormal gait, any abnormal movement, any behavioral changes? Any abnormalities in the eye like droopy eye? So eye vision, so much important asking. Any concern regarding visions, diplopia? Any redness or puffiness, asymmetry of the face? Any concern regarding her hearing? What about her sensation? If you but something cold on, can she feel it? Is it associated with headache, any morning vomiting? What about her way of talking? Like a nasal sound, interrupted, understandable, occur at certain time, dysarthria, any problem in swallowing to fluids or solid dysphagia. So again the chief complaints analysis I am repeating. First of all, fatigue chief complaints or difficulty walking, difficulty swallowing, and they have recurrent chest infection present. So ask first, are they started together or one by one? Then start with the serious one first. OCD, onset, course and durations, anything make it better, anything make it worse. Then timing. At the end of the day, remember it worse, increase with fatigue, tiredness and stress and relieved by rest. So morning time he feels okay. Site of weakness, unilateral or bilateral, where starts first? Does she have any weakness in going up and downstairs? Any weakness on combing her hair? Any abnormal gait, any abnormal movement, any behavioral changes? Any abnormalities in the eye like droopy eyelid, any concern regarding vision, diplopia, any redness or puffiness, asymmetry of the face, any concern regarding her hearing, what about her sensation? If you but something cold on, can she feel it? Is it associated with headache, any morning vomiting? Then what about her way of talking, like nasal sound, interrupted, understandable, occur at certain time, dysarthria, any problem in swallowing to fluid, dysphagia. Then general FWASL, fever, weight, activity and sleep. Any other concern, any chronic illness or long-term medical condition, maybe with other autoimmune disease. Then we are going for the systemic review one by one. MSK we ask like any skin spots, any swelling in any part of the body, any hyperpigmented lesions in the body like vitiligo, any hair loss, alopecia. So these are the features like alopecia, vitiligo associated with because other autoimmune diseases are connected. Then recurrent chest bug, recurrent chest infections, they have the problem. Recurrent bugs, cough, how many pillows using during sleep, CVS about the heart racing, exercise intolerance, chest pain or shortness of breathing, especially on lying down and fainting attacks. GIT about the tummy size, tummy pain, throwing up. Describe for me his poo, loose or constipations and yellowish discoloration. Urinary about the P concern, polyuria, polydipsia to exclude diabetes. Remember autoimmune are friend. Thyroid and the diabetes they are friend and myasthenia gravis. Any other one measure her blood pressure. Then endocrine about the hot or cold intolerance, thyroid, any lump in the neck, and anyone measure his blood sugar. Then about the hematology, pallor, recurrent bugs in the body, swollen glands in the neck, numbness in the fingers, for pernicious anemia. Okay. Then we go to the 5T IOA, that is past history details we'll take. Like ask about any head trauma, any drug. Is he in? If he is in chronic case, ask about his medication and compliance and drug level, because some drugs exacerbate conditions. So other drugs which may interfere with these conditions are beta blocker, azathioprine, ciprofloxacin, naltrexone acid, neuropsychiatric drugs, penicillamine, and gentamicin. Then previous condition when discovered, by whom, how it was presented, is he admitted to hospital in normal ward or ICU, for how long, what they did for him, how long he stayed, after discharge any medicines was given to him, did you follow with any team. Then previous hospitalization in normal ward or ICU, what done, investigations and medications given on admissions, which team following with. Perinatal, natal and postnatal. Birth history is very important. Fetal movements like polyhydramnios during excess amount of liquor around the baby. Anything doctor told about you. Then any feeding difficulties in early neonatal period. Any admission to NICU. Very important. Vaccination, missing any shots, any extra shots. Allergy, nutrition as usual. Development is he look like his peers in way of walking and talking. Then family consanguinity, how many children's, history of similar conditions, history of deaths in the family, especially autoimmune disease, especially mother's side. Social and financial, what did you do for living? Is it satisfied for you? Did you have any easy access to hospital? Who take care of the other kids when you go to the hospital with? Do you have insurance? Receive any support? Then school psychological and the impact. What are the differential diagnoses we can keep for myasthenia gravis? So myasthenia gravis is easy fatigability, myopathy. It can be first myasthenia gravis, then myopathy like Duchenne muscular dystrophy, DMD, then Becker muscular dystrophy, juvenile dermatomyositis, hyperthyroidism. It can be other like Guillain-Barré syndrome, neuromuscular disease, Horner syndrome. Drugs are botulinum, organophosphorus poisoning, ptosis. Remember the child has ptosis present, droopy eyelid. So what are the cause? Bilateral unilateral ptosis. I am telling bilateral Noonan syndrome, Smith-Lemley Opitz syndrome, Rubinstein-Tybee syndrome, bilateral third cranial nerve palsy, migraine and craniosynostosis. Unilateral or idiopathic trauma, infection, tumor, retinoblastoma, congenital ptosis, unilateral third cranial nerve palsy, Horner syndrome, Marcus-Gunn syndrome, local pressure on the eye. So this is all about myasthenia gravis history. Thank you.